Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Now, indications of insulin. Indications of insulin. Insulin is indicated actually in type 1 diabetes mellitus, then in patients who are underweight patients, in type 2 underweight patients in type 2 diabetes mellitus, or it is indicated in late cases of type 2 diabetes mellitus, and also it is also important in maturity onset diabetes of young, and it is important in infections, trauma, surgery in diabetes mellitus. It is also important an indication in sulfonylurea resistance. It is also an important indication in sulfonylurea resistance or diabetes mellitus in pregnancy, hyperkalemia, or if there is diabetic ketoacidosis, we should give insulin, and it is also important in hyperosmolar hyperglycemic coma.
thank you and thank you for watching.